So there's a most recent meta-analysis in preterm infants. It's the third edition, 2012, by my friend and colleague Heike Robb. And it is a combination of 15 studies. The babies were delayed. These are just pretermers, 30 to 120 seconds. It involves 738 preterm babies, 24 to 36 weeks. There's one randomized controlled trial on cord milking that's included, and two randomized controlled trials which report blood volume. Let's look at the safety variables first. And if you haven't looked at these kinds of slides before, these from the meta-analysis done by RevMan, I put a red line around the first one where you look for the significance, and then over here you look to whether this little dot falls on the more placental transfusion better or the less placental transfusion better side. And sometimes those vary. But anyway, you can see here in essence that there's no difference in APGAR scores. So there's no reduced APGAR score by waiting that period of time. There was not, the temperature on admission did not reach significance, although there's a slight trend. One could say that the babies are a little bit warmer if they get their blood. That kind of makes sense. And the peak serum bilirubin was higher, as you can see here. However, bilirubin needing treatment did not reach significance, although, again, it's getting going to that side. So this is a Strauss quote. I forgot where I put it. But anyway, he said, and I quote him directly, although significantly more of our neonates received phototherapy for jaundice after delayed cord clamping, there were no differences in serum bilirubin values prompting this therapy or in the intensity of the therapy required. Now, those were all pretermers. So we're just going to look quickly at the physiologic measures. There was, of course, one would expect an increase in hematocrit levels, both at 1 hour and one at 4 hours. An increase in blood volume from 2 studies, and an increase in red cell volume mass from the group in Iowa that has the biotin, uses the biotin process. There were fewer babies transfused for anemia, and babies had fewer numbers of transfusions. And looking at the major outcome variables, was the death did not reach significance. Oxygen at 36 weeks was not significant. IVH, all grades, did reach significance. There was less IVH with the babies getting a placental transfusion. However, there was not a difference in severe IVH and PVL.